McKenna. I'm a HOSA alumni and a current physical therapy student at the University of Montana, and I'm going to show you how to do passive range of motion for the physical therapy skill. Knock on the door, or the sheet says 3 to 5 reps. I'm just going to do a few, but the judge will tell you how many they want to do, and they will also tell you a specific side. I'm just going to be doing the left side because that's what's easiest for me. So, wash my hands, knock on the door. Hi Easton, I'm McKenna. I'm going to be your physical therapist today. We're going to do some range of motion for all of your joints. Is that okay?
Yep.
All right. I'd make sure you'll probably be in like a bed, so I'd make sure if there's a side or a bed rail here, you put that down. Make sure the brakes are locked so that the patient doesn't move while you're going. And then if the patient is in a hospital gown, or if you're in like a hospital setting, you would want to drape the patient kind of over their abdomen and leg area, kind of like that, so that the gowns aren't, they aren't pants, so they aren't great for the patients, and that way if there's people walking by, the patient feels all right. But I'm not going to use it for this since Easton has pants on. All right. So first we'll do shoulder AB and adduction. So I stabilize under the elbow and at the wrist. And so then this motion is abduction, and you go up as far as they can go. And then adduction is bringing it back to the side of their body. And then the same thing for shoulder flexion and extension. I stabilize at the wrist and at the elbow. And we'll go up into shoulder flexion. And if you need to move your elbow positioning or the hand that's stabilizing there, you can. And then back down is extension. And then we'll do elbow flexion, extension, and I'm stabilizing at those same places. So elbow flexion, as far up as they can go. Elbow extension all the way back down. And while you're doing this, kind of keep an eye on the patient. You don't want to be forcing them into something that's painful, or some people don't have much range of motion, so when you feel it kind of like stop, like if he was like resisting me right here, then I wouldn't try and push it any farther. Just go until you kind of feel that stopping point. And then for wrist flexion extension, I'm going to stabilize at the like forearm right here, and then the sheet says palmar and dorsal side of the hand, so it's just this like the meaty part of your palm and hand. So this is wrist extension right here, and then wrist flexion, and then we will do the fingers. I don't think it specifies doing all of them at once or one at a time, but if you did one at a time, extension, and then flexion down this way. Or you could do all of them. Just make sure you're stabilizing at the wrist. Extension this way, and flexion down this way. And then we'll do finger AB and adduction. So for abduction, I'm pulling the fingers apart like this, and adduction is just bringing them back to place. So I would do that for all these fingers, AB, AD, abduction, adduction. And then next is the thumb opposition. So that is me bringing the thumb and these fingers together. And since this is passive range of motion, I am the one doing it. I'm not having the patient do this themselves. And then next is thumb opposition. So I'm just going to stabilize like the meaty part of your hand and kind of hold on to this joint right here at the thumb. And then you just want to go in a circular motion. And that is thumb circumduction. All right, and next we'll move on to the hip. I have to, yeah. I missed, so next we'll do ulnar and radial deviation. So radial deviation, your radius is on your thumb side, so this is radial deviation, and then ulnar deviation is on your pinky side. So for this, I stabilize at the forearm, and again, the meaty part of your hand, and we'll do radial deviation towards the thumb side, and then ulnar deviation towards the pinky side. And these ones you definitely will feel like where they have a stopping point that seems not very far compared to what you would think. All right, now on to the leg. We will do hip abduction and adduction. So I'm holding underneath the knee, and then kind of at the ankle, or kind of where your Achilles tendon inserts into your calcaneus. So this is abduction of the hip, bringing it out to the side, and then back is adduction. And then for hip flexion and extension, they'll bend their knee. And then for flexion, you bring them all the way up. And then for extension, you'd bring them all the way back down. Knee flexion is kind of the same, so stabilize just above that knee and at the ankle, and we'll flex the knee until a stopping point, and then we'll extend it and bring it all the way back down. And then hip medial and lateral rotation, I hold just above the kneecap. And then this is medial rotation or internal rotation of the hip. And then this is lateral rotation or external rotation of the hip. So you're just stabilizing here so it doesn't move too far. All right, and then next is ankle dorsiflexion and plantar flexion. So dorsiflexion is bringing your toes toward your shin, and plantar flexion is bringing your toes towards the ground, like that, so you're like planting your toes into the ground. For this, I'll just stabilize under here, and then I think the rubric says underneath the foot. So dorsiflexion, which there probably won't be much there, and then plantar flexion, toes towards the ground. And the next is inversion and eversion of the foot. So this, you just turn the foot inwards for inversion and outwards for eversion. And then we can go over here for the toes. The toes are just like the fingers. So for abduction, you pull the toes apart, and then for adduction, you put them back together for each of the toes. And then same with flexion and extension. I would probably stabilize around the ankle and then put them down into flexion, and then bring the toes up into extension. And then before I left the patient, I'd make sure that they didn't have any pain with anything. Make sure the bed rails are locked. I'd put the side rail, put that back up in place, wash my hands, and then I'd be done.